This is basically the integration of the National Program for Control of Blindness with Ayushman Bharat, Arogya, Karnataka. So through the presentation, I will be giving an introduction of what ABARK is, an introduction to the program and what integration have we done and how the process is implemented in betterment of the cataract surgeries. So what is Ayushman Bharat Arogya Karnataka scheme is, the state of Karnataka aims to have a universal health coverage. So based on that, we had a scheme known as the Arogya Karnataka, which would provide a 2 lakh floater per family per annum, and which later on the government of India also started a similar program known as the Ayushman Bharat, which had a greater coverage with over rupees 5 lakh per family per year. So both these schemes were integrated together and is now known as the Ayushman Bharat Arogya Karnataka scheme. Through the scheme, it involves 1650 procedure codes, which will be involved for any patient care. So in this, we have two categories. One is the general eligible patient and second is the general patient. So patient comes under the eligible category if he's a resident of the state, or he holds the BPL card or a beneficiary of the SCCC data, or he's already been a member of the existing Rashtriya Swasthya Bima Yojana. Then he attains a cashless service of up to rupees 5 lakh per family on a floater basis. Whereas if a patient is a resident of Karnataka but not a BPL card holder, he is an APL card holder, then we provide him up to rupees 1.5 lakh per family per year. So this is basically the Ayushman Bharat Arogya Karnataka scheme. Now, as I said, the scheme includes 1650 procedure codes. So out of these procedures, we have certain procedures which are related to cataract surgery. And we have another program at the national level known as the National Program for Control of Blindness. So this program was launched in 1976 and it's completely and 100% centrally sponsored scheme. The main goal of this scheme was to reduce the prevalence of blindness from 1.4% to at least 0.3% by 2020, which has now been a little delayed due to COVID. Knowing the global causes for visual impairment are basically accounting for unoperated cataract surgeries, accounting for 33%. And cataract is supposed to be one of the main causes of blindness in India, as per the NPCB 2015 data. So keeping these two objectives in mind, the NPPCP program had the following objectives and strategies. So can you please press enter? Yeah, so the main objectives of the NPCP program were they're conducting three main activities. One was at least to perform 66 lakh cataract surgeries per year. Secondly, to have a regular screening camp in schools and to provide at least 9 lakh free spectacles per year. And the third main objective was the collection of at least 50,000 donated eyes per year for keratoplasty. And to attain these objectives, the main strategies that they focused on was a continued emphasis for free cataract surgeries, as many patients denied surgery since it was a financial burden to them. The second thing was reduction in the backlog of the blind persons by active screening, which was done through the healthcare involvement as well as the involvement of other NGOs. So this was the main background for NPC. So now, through the integration, we integrated NPCB with ABRK and hence knowing as empowering vision. So through this, what we've done is both ABRK as well as NPCB has the main goal of attaining a community ophthalmologist. So we've integrated the major causes of blindness into the services at an affordable rate. So in line with also the Vision 2020 and the Universal Health Coverage Scheme, the main thing that we focused on was preventing cataract blindness due to cataract surgeries. So all the cataract surgeries which are performed in government hospitals or any private empaneled hospitals would be cashless, as well as the performing doctor will get an incentive. So through this, we ensure that people are, performing more surgeries so that the doctors are also getting an incentive. And since the patients are having a cashless surgery, they would definitely opt for it. The implementation of the program happened was to provide financial aid to the surgeries, as I mentioned. Second thing is with this, we can even understand what are the gaps in the government hospitals that need to be filled based on the capabilities module. And through this integration, whatever cataract surgeries have been done in the public health institutions for BPL population and Aadhaar would be claimed under the ABARK amount. Whereas for those with the APL card or who are an non-resident of Karnataka or not having a ration card would be claimed under NPC. So the integration involves funding from both the parties. Next slide, please. So this is overall sum for the last 4 years, right from when the program has been started, of how we have improved in providing the services. If you could see the financial year of 2019 to 20, we've amounted for around 12,700 change surgeries. Whereas if you look at the rate 2 years later in the financial of 21-22, we've amounted to 29,900 change, which is like, double the amount of what the surgeries were performed earlier. And this up till the present year, May 2022, is around 7,000, which is in a span of 4 months. So total out right now, out of this integration, we have performed around 64,310 cataract surgeries and provided funding. On the left side, you're seeing 4 procedures. These are the different type of cataract surgeries that are involved in the integration. Next slide, please. So what are the main benefits of this integration and how is it unique from different tests? First of all, an integration of the NPCP with ABRK is one of its kind in the state and has not been implemented anywhere across the country. Second thing, to ensure that there is no misuse or data duplication, we have the ABRK's IT platform, which provides us all the data. And second thing, by this, we're reducing the out-of-pocket expenditure as well as understanding the gaps in the government hospitals. And as we're providing an additional incentives for the doctors performing these procedures, there's more improved outcomes of the procedure. And at the end, overall, this will definitely strengthen the government systems as well as the health system. Thank you, sir. With this, I would like to conclude. If you have any doubts, I'm open.
Thank you, ma'am. Please just tell, are you covering glaucoma and other things or only cataract?
So currently we've been covering only cataract, glaucoma and all would be covered down the lane as we're focusing on what are the major causes of blindness.
No, because glaucoma is supposed to be a major cause of blindness.
Yeah, it is supposed to be a second cause, but currently we're focusing on cataract. Down the lane, we would be getting with glaucoma.
Oh. Oh. Good.
Sir,
okay, thank you.
Sir, good morning, sir. Dr. Suresh Shastri here. I am the Joint Director for this program. The glaucoma presently in this 1650 procedure codes, glaucoma is not there. Glaucoma will be there in the next package, which is coming as Health Benefit Package 2022, sir, where glaucoma is also part of that scheme, so that the number of procedures will increase from 1650 to 1949. So in that, glaucoma will be covered.
Excellent. Thank you very much for the clarification.
Thank you, Dr. Saab, for excellent work.